Hi, everyone. Welcome to Kudzi Chronicles podcast. I am your host, Kudzaiva Shaya, and I'm so honored and excited today to have my dearest sister on the podcast, who is a medical doctor based in the UK. She's a wife. Yes. Thank you so much, Dr. Tanaka.
Thank you, Kuzu, for having me. It's such a pleasure.
Yeah, all right. Are you ready? Do you think we should get into the questions?
Yeah, I'm ready when you are.
Okay. So my first question is, why do you think it's so important for medical students to have fun and sort of have a life outside of medicine? Yeah, why is that so important?
Okay. So it's really very important for a medical student to have a life outside of medical school because
Mm-hmm.
medical school can be so demanding. It demands physically, it's demanding spiritually, even emotionally. So it's
Yeah,
really good for you to take some time off doing other things that are not medical related, just
yeah,
for your own self, because I feel like if you just keep on doing the same things over and over again, let's say like you just keep on studying, not making time for your
yeah,
own personal needs, you might end up
yeah,
getting into a burnout, which is not really a good position to be, honestly. And once you get in a burnout, sometimes it might be so hard to get out of it.
yeah,
So I would just advise guys, always make sure like you have time to have fun. By fun, it does not necessarily mean going for a groove or doing crazy stuff. You can actually
yeah,
read your novel inside your room as long as it's not
yeah,
medical related. You can watch your
yeah,
Netflix series, you can go for a jog outside, you can even go for a walk. Something
yeah,
that is not part of your day-to-day activity, like that is out of medical school, really. It
yeah,
actually helps you to to recuperate, to have more energy to do other things, which is what you
yeah.
need. Yes.
It's true. Thank you, sis. I love that you said you don't have to go to group or do all these crazy things to have fun. You can do anything, like sleeping even.
Yeah, even
Yeah,
sleeping, but too much of
yeah,
sleeping, really, it's not good for you at this young age, really.
yeah.
You need to be outgoing, you need to
Really,
be doing other things.
you need to have fun. Yeah.
You need to have fun, period.
All right. Thank you,
Yes.
sis. My next question is, when you were in medical school, how did you balance having that life out of medicine and also still being a good student and getting good grades still?
Oh, okay. So the thing is, when I was in medical school, I was so lucky because I had friends who were also doing the same program.
Yeah,
So those are the friends I would go out with. Those are the same friends I would study with. I would do discussions with. So
yeah.
it so happened that like whenever we go out, there will be someone who will be holding you accountable for whatever you will
Yeah.
be doing. So like after a
Mm-hmm.
night out, there will just be an accountability partner asking you, did you
Mm-hmm.
manage to do the homework we were given? Did you manage to type the assignment? So in
Yeah.
that way, it kept me in track, and I was also like accountable for everything that I'll be doing
Yeah.
outside of medical school so that I do live a balanced life. So I would really
Okay.
advise for you to make friends in the program. It's
Okay.
always good to have someone who's doing the same program as you, because that way you can as well have someone who can actually account for your actions. Not necessarily judge you for your actions, but just to
Yeah.
hold you accountable so that you're always in track. You're not,
Mm-hmm.
you're not lagging behind, or you're not doing things at the cost of your books, really.
Yeah.
So
Yeah.
it's so much very important. You can even have like, well, what you call a course bestie, a course
Yeah.
wifey, course hubby,
Yeah.
so that like he or she keeps you in track, and it's a way of
True.
helping each other, really, because with medicine it's not just about individuality. You need everyone on track, because like
Yeah.
like when you start practicing, you then realize that it actually takes the whole team for you to help a patient, to treat a patient. It's not an
Yeah.
individual main job. It requires the
Yeah.
whole team board. So we really need
Yeah.
each other, and really like you don't lose anything to help the other person next to you to achieve their
Mm-hmm.
goals, to even achieve better grades. So like
Yeah.
it's part and parcel of the training as well, to to be
Mm-hmm.
able to mentor the next person, to be able to encourage the next person to become better really. So
Yeah.
yeah,
Yeah.
that's how you can really strike a balance. You need the other person so that you work as a
True.
team, and it will make the dream work really.
Yeah. Thank you, sis. I'm writing notes.
Uh,
Okay. So now that you're done with school, you have finished the many, many years of medical school. Would you say that it was all worth it? Is it worth it?
well, the thing is, I can say it was worth it, honestly.
Yeah.
Um, So the thing with medicine, it doesn't just come with monetary benefits. It also comes with
Yeah.
non-monetary benefits. So I will dwell more on the non-monetary benefits because the monetary benefits
Okay.
they're a bit tricky depending on like where you're practicing and
Yeah.
the years of experience and the stage you are really. So it
Yeah.
just varies. So the non-monetary benefits really are what really keeps you going because the title
Mhm.
itself, it's a very nice title. It comes with a lot of prestige. It comes with a lot of
Yeah.
opportunities. Just because you're a doctor, if you just want to apply for a loan, your chances of getting that loan they are higher just because you're a doctor. Number one, not
Yeah.
necessarily that you have the money, but because of your profession, people tend to think that you're trustworthy. I mean,
Okay. Okay.
because of the nature
You're
of
a
the job,
doctor. You should be
exactly.
trusted.
Because you're
Yeah.
a doctor, like you're expected to be trustworthy in a way. So the chances of
Yeah.
you retaining the money they are very high. So you get opportunities of even getting bank loans. Those bank loans you can use them for various things. You can even use them to start your own businesses and a whole lot of other things, depending
Yeah.
on what you need the loan for. And also,
Yeah.
like in the community, we are respected, which is
Mm-hmm.
also a good feeling really. And the fact that
Yeah.
like when you assist someone, when you treat someone, that feeling of just being able to treat someone and they get better, it's so fulfilling and it really keeps you
Yeah.
going, like it makes you happy in a way. You feel like you're contributing towards something big in life, which is
Yeah.
very important. So like every day, this is a job whereby like you're rewarded like almost on daily basis depending on like the results you're getting from patients. But
Yeah.
it's I think it's really worth it. Then in terms of the monetary benefits, uh
Mm-hmm.
it gets better really. It gets better. Like when you
Fine.
specialize or when you try to do other things, it really gets better.
Yeah.
But like initially when you just starting, like when you're a junior doctor, maybe SHO, like you might not be able to see the monetary benefits per se because you just be living from hand to mouth most of the time, depending on where
Yeah.
you are practicing really. But it does get better. So it requires a lot of patience. You need to be very
Mm-hmm.
patient with yourself and a lot of consistency. You need to keep on like
Mm-hmm.
being consistent. You also need to
Mm-hmm.
keep on improving yourself, even like in terms of qualifications. Besides the degree you have, you can also like make use of other small certificates or diplomas that you can just achieve, just to
Yeah.
boost your CV so that you actually
Mm-hmm.
get better opportunities. It might not
Yeah.
necessarily specialize. You can even choose to take other avenues which are not related to medicine, but it will
Yeah.
actually help you uh, take that route just because you're a doctor. Even like when it
Yeah.
comes to specialize, I mean, to postgrad programs, it gives
Mm-hmm.
you like a variety of options really
Mm-hmm.
because you can actually venture into any other field when you're coming from medical school. Not
Medicine.
all the
Yeah.
fields per se, but like most of them. You can actually, you
You
can
can
even
go
do
into.
something related to business after medical school. You can even do something related to piloting. You can actually become a pilot even after medical school, or
Really?
even do medical
Really?
aviation. You can even do
Yeah.
sports medicine. If you
Yeah.
want to be dealing with the sports people and stuff. So, like, it gives you a
Yeah.
lot of opportunities really to do other things
Yeah.
that you wouldn't have gotten an opportunity to if you didn't do the medicine degree.
Yeah.
So I would say it's really worth it, but you need to give yourself some time because it really
Mm-hmm.
takes time. As you can
Yeah.
tell, like as you can see also like from your medical schools, just the 6 years versus the other 4 year degrees,
Mm-hmm.
already
Yeah.
it shows something about the program. It means it's going to
Mm-hmm.
require a lot of time, it's going to require more of you, and the way it's so demanding. But at the end, it's just going to be worth it. But it
Yeah.
requires a little
Mm-hmm.
bit of patience. It comes with a lot
Mm-hmm.
of challenges, really. You can face one or two challenges or even more.
Yeah.
Because like
Yeah.
with Sen, unfortunately the medical field is directly linked to the politics of wherever you are, because
Yeah.
like if
Yeah.
there is poor governance, unfortunately it will also tend to
Affect.
affect you as a
Yeah.
doctor. But
Okay.
there are so many options really. You shouldn't just be stuck in one place. You can as well leave
Yeah.
the other country that you feel like you're not being appreciated, and join other countries that they are paying better. I mean, the sky
Yeah.
is the limit after you've gotten
True.
your degree. So it's really worth it. You shouldn't despair. Yes, there are challenges along the way, but it will be worth it at the end of the day. That's all I can say.
Ooh, ooh, thank you, sis, for opening our minds. I actually didn't know that you could be a pilot, even though you're a doctor.
No,
That's
yeah,
so
yeah. You
nice.
can actually be a anyway, for you to be a pilot, to be honest, you don't need a degree. You just need
Yeah.
to yeah, you just need to have I think 5 O levels if I'm not mistaken.
Oh.
With yeah, you need to have science, a bit of sciences. Yeah, yeah, that's all you need.
Mm.
So I mean, like my point is, just because you're a doctor doesn't limit you to that field. You can still
Yeah.
explore the other career options that might not be medical related.
Yeah.
Like for instance, if you are to choose to become a pilot after becoming a doctor, you can now match the
Mm.
two, and so now you'll be able to do you now be able to do like medical aviation, and you will be able
Mm-hmm.
to also fly planes, which is a
Yeah.
powerful
Yeah.
combination.
That is
So
so cool.
it gives you so many opportunities to venture
Mm-hmm.
into. So you shouldn't just look at it as an end point. It's actually like a starting point for
Mm-hmm.
you to become a greater person, for you to become the person you really want to be. It shouldn't
True.
limit you just because you're a doctor. You shouldn't just be limited within the medical field or within the medical career per se.
Yeah. Yeah. Wow.
Yes.
Thank you, sis. I think my friends are going to love this. Okay. So my next question is, I mean, now that you've finished medical school, how is it in the hospital? I mean, with the experience that you have now, how is it like? How's the life? Is it, I mean, I know it's different, obviously, from med school, but what is something that maybe surprised you or something that you didn't know, something that you found out after working in the hospital? How is it like?
Oh, okay. So the thing is, like once you get your degree up to like
Mhm.
when you start working, like no one
Yeah.
really prepares you for the transition. Because like when you're medical
Um,
student, you just like have this, inferiority that but I'm just a medical student. Like you can't
yeah.
contribute much, Most of the time you'll be intimidated by the seniors and a whole lot of
Yeah.
other staff members. But like
Mhm.
the moment you qualify and you get a job, let's say at a certain hospital, the moment you're
Yeah.
just put on the roster, the next thing they expect you to be playing doctor. So I
Yep.
I feel like it's not a lot of people who are actually like prepared for such a huge transition, because like when you're medical student,
Mhm.
of course you're respected, but it's not a much of a big deal. It's just
You're a
minor.
medical
But like when
student.
you become a
Yeah.
doctor, everything changes completely. People just expect you to play doctor very well. They expect you to give orders, to treat patients. And like on your
Mhm.
first day of call, you'll be seeing patients queuing, waiting for you
Yeah.
to see them, which is no one really prepares you for that. And it's really
Yeah.
shocking, and unfortunately, you just need to, prepare yourself for it so that you'll be
Yeah.
able to manage, because it can be so overwhelming, especially your first call.
Mhm.
Like most people call it baptism with fire, because it's literally baptism
Yeah.
with fire. And
Yeah.
like Yeah. Because like the textbooks and the patients you see on the, because like now, as a doctor, you're now seeing patients uh when they present, not before they were
Yeah,
stabilized. So you're actually
yeah.
seeing like you're the first person to be in contact with the patients, and you're the one who's supposed to
Wow.
stabilize them. So usually, like when you're a medical student, you actually see the patient when they have been stabilized, when they are now on the ward. But in the emergency department, you
Mm-hmm.
really don't get to see them. Maybe like when you're in final year, but still when you're in final year, sometimes you really not sometimes you don't go to the emergency department, you just see them on the ward. Obviously, a
Yeah,
lot of things
yeah.
have been done in the emergency department that you might have missed, or you just see as part of the management. So the patient, in a way,
Mm.
would be in a recovering process.
Yeah.
So it's something that really shocked me, especially like my first day of work. I actually
Yeah.
like go
Tell
to
me
work
about that.
early. I will actually like go to work early. Now I was so chilled. I just introduced myself to the sisters. I was like, I'm Dr. So and so.
Yeah.
Just started. It's my first day at work. What? So like you
Mm-hmm.
just be expecting for them to be lenient or something like that. Then the next thing there was an emergency, and everyone was calling
Uh-oh.
out my name, Doctor. Please, there's an emergency. Can you come in? Yep. And you're like, an emergency. But guys, I just
I
introduced
just
myself as a
arrived. I just
like I'm.
arrived.
I don't have any experience of being a doctor. And I was sort of.
Yeah.
I saw a consultant passing by. Then I had to call for help, and he also
Mm.
joined. So we worked together, and
Okay.
things actually
Yeah.
went well. So these are some of the things no one really prepares you for. When an emergency happens,
Mm.
even like on your first day at work, people still expect you to be playing doctor very well. Like you just need to be doing your doctor moves, your doctor skills. In as much as you feel
Yeah.
like maybe you're not yet ready, you just like you need some time to transition from being a medical student to becoming a doctor.
Mm-hmm. Mm-hmm.
Yes.
Wow. That
Yeah.
is so scary and exciting at the same time.
Yeah, you can say that again. But I mean, it gets better with time because, like, I feel like,
Yeah.
yeah, the first month it's really hectic because, like, you won't be, like, you still be learning to do some of the procedures.
Yeah. Yeah. Yeah.
So yeah, it will be a bit difficult, but you just need to be very patient with yourself and learn as much as you can. Because like when you are an
Mm-hmm.
intern, this is the time you are allowed to make as many mistakes as you can. This is the time you are
Okay.
allowed to ask as many questions as you can. Because as you start climbing up the ladder, there are certain things people just expect you to know,
To
and
know. Yeah.
exactly, and it will be unforgiving for you
Yep.
not to those things. They will never forgive you for not knowing. So
Not
I just
knowing.
feel like you
Yeah.
need to make the most of the time whereby you're doing your internship.
Okay.
Then
Okay.
another shocking thing was also like like when you are, especially like when you get to final year, you just be like, let me
Mm-hmm.
just get over this. After this, my
Mm-hmm.
life is just gonna be different. I'll just be working.
Yeah.
Unfortunately, when you start working, you also still need to study, you still need to read, you still need to be, up to date in terms of what's going on in the world. So there will never
Wow.
be a time whereby you won't be studying, unfortunately. You still need to study
Yeah.
because some of the things that you might have learned, let's say in medical school, the management might change, might be tweaked a little bit. So you need to be very up to date with the new management. And also
Yeah.
another thing is if you do not read, some of the things you tend to forget.
Mm-hmm.
So
Mm-hmm.
you need to be consistently reading so that you're always up to date and you're competent. But
Okay.
a
Okay.
lot of people have this perception that, it's actually a misperception that once you're done with medical schools, you're done with your books.
You're done with the
And
books.
sometimes we tend
Mm.
to even sell the books. Sometimes you might actually need to just go through your anatomy book just to check because just
Mm.
because it's been long since you've done your anatomy, there's certain things you just need to make sure that you actually know
Yeah.
of, or you just need a refresher course in a way.
Okay. Okay.
So yeah, you have to keep on studying even when you have now qualified as a doctor.
Okay. Wow. Thank you,
Yes.
sis, for sharing and opening our eyes. Wow. So, what would you say has been the best part so far? What's the best part about your job?
So, well, the best part about my job really is just going back home when you know that you've
Yeah,
given it your all.
really going back home.
No, as in going back home, knowing that like you've done your best in terms
Oh,
of trying to help the patient, not not
oh
just the.
yeah. Okay.
So
Yeah,
I've had so many instances whereby I was really, was really happy that I managed to do certain things to a patient.
yeah,
For instance,
yeah.
I was doing cover on a Saturday. We
Mm-hmm.
were forced to call, like our firm was forced to call. So,
Yeah.
like when you're doing cover on a Saturday, usually you're not supposed to be doing long ward rounds like you do during the
Mm-hmm.
week. So
Mm-hmm.
I just went there with the perception that I'm just gonna go in and out. And it so
Mm-hmm.
happened that one of the patients that was admitted with DKA, he had
Yeah.
relapsed and all the cannulas had fallen off. I don't know if you
Uh-oh.
have gotten to that stage, like whereby you now know the management of DKA and stuff. But like for
I,
you to manage a
I
patient
think
with
I'm supposed
DKA,
to know, but sis,
but for
don't put me on the spot.
no, I know why. But no, I mean, you get there. But for you, in
Yeah,
order to manage
thank
a
you.
patient with DKA, you definitely need
Mm-hmm.
a working cannula. Because you need to be running in fluids and giving IV insulin and a whole lot of other things.
Okay. Mm-hmm.
And when I actually tried putting back the cannula, all the veins were collapsed. Obviously this
Uh-oh.
patient was deteriorating very quickly, and was that like she was almost about to lose consciousness really, because it was really
Uh-oh.
really that bad. I called my registrar. We tried getting hold
Mm-hmm.
of the what do you call it, the anesthetist to put
Yeah.
up the cannula. The anesthetist is so happened they were also attending another emergency, and their
Uh-oh.
hands were tied. So I then ended up calling my registrar, and she was like, you know what? You just need to put a femoral catheter, a femoral
Mm-hmm.
CVC, So like I had
Yeah.
recently learned on how to put like a femoral IV catheter,
Mm-hmm.
and it's something that I was comfortable doing really, but it's not something that I would just do on any other patient. And
Yeah.
the registrar kept on giving me pressure, and like there was no way I was going to leave a patient in that state. Mind you,
Mm-hmm.
it was almost 4 hours of being on the ward, not coming up with a proper solution. And then I was just
Uh-oh.
like, let me just do it to help a patient. I then rushed to the pharmacy. Like, ideally, you're supposed to be using the nurses to order the things you need.
Mm-hmm.
But I just
Mm-hmm.
told myself, you know what, I just need to do it on my own for it to be quick. I had to rush to the pharmacy, compare all the things I needed, and
Mm-hmm.
started putting the IV catheter on the patient. And it so happened it went well, and we started giving the patient fluids. Fast forward to the following day.
Mm.
Anyway, I actually like got home. I was supposed to be home
Yeah.
by because I had started my ward round around 8:30. I was supposed to be home by 10:30. I ended up
Yeah.
leaving the ward around 3 p.m., which wasn't
Wow.
planned. And like on a Saturday, like you just be, wanting to do other things not related to
Yeah.
work
Go
and stuff.
home. Mm-hmm.
Exactly. And then fast forward the following morning, I saw the patient. Patient was now stable, communicating.
Ooh.
Like it was so rewarding. Like I
Yeah.
was really happy that like, all the effort that I actually put in, it actually amounted to something. So
Yeah.
like those
Like
are
I
some
did
of
that.
the instances that actually keep you going, that actually keep on motivating you, in as much as your payslip might not be as motivating. But yeah,
Mm-hmm.
those are instances that actually like keep you going really.
Yeah. Wow. Thank you so much, sis. What is your advice for students who are going to start their clinical rotations maybe next month? What's your advice for those people? They have no experience. They just know the theory part of it. This is going to be their very first time in the hospital. What would be your advice?
Well, my advice would be really they just need to experience everything in person. Like
Okay.
sometimes you're just tempted to bank what rounds.
Yeah. Yeah.
You need to make sure that you put an effort to attend, because some of the things really you do not find them in the textbook, but you find them on your patient.
Yep.
So
Okay.
it's going to be something very informing, really, going for what
Mm-hmm.
rounds, because some of the symptoms you're just reading them in the textbook, but like when you get to
Mm-hmm.
see them on a patient, it's a
It's
whole
different.
different experience. And
Yeah.
most of the time, when you see a certain symptom on a patient, it's
Mm-hmm.
hard to forget about it, really, because the next time you're
Yeah.
going to see a patient, you're going to recognize, unlike when you read it from the textbook and you don't see a patient with that symptom, it might be
Mm-hmm.
so hard for you to pick up the symptom
Yeah.
from the textbook, unlike the
Yeah.
symptom you would have seen on a patient. So
Yeah.
you really need to prioritize your ward rounds, and you'd also need to take care of yourselves.
Okay. Yep.
By taking care of yourselves, I mean, I'm sure like you all have been vaccinated for hepatitis B.
Yeah.
Yes.
Yeah. Yeah.
In case like you missed one of the booster doses or something, or you didn't get the
Mm-hmm.
three initial doses, this is the time for you to actually consider getting it ready, because things do happen on the ward. Sometimes you
Yeah.
may ask it to assist on a procedure. Next thing you get a needle prick. It
Uh-oh. And
wasn't
now
something
you're
intended,
yeah.
and now you've been exposed. So make sure that you've gotten your hepatitis B vaccines and everything is in order. Number one, two, you're also going to be exposed to certain infections like your TB,
Mm-hmm.
unfortunately.
Mm-hmm. Okay.
So you also need to really take care of yourselves. By taking care of yourselves, you need to have a balanced diet. You need to have a less stressful life, because if you're
Mm-hmm.
not having a balanced diet, it means immune wise you'll also be compromised.
Yeah.
Then
Yeah.
if you stress, or your immune system will also be compromised anyway. So you really need to take care of yourself, because like sometimes you find yourselves getting those infections from the ward,
Yeah.
and you just need to follow the guidelines in terms of the infection control, because in a way it's a
Mm-hmm.
way of helping you. And I've seen like a lot of people, they might take it as slaying. Sometimes you see medical students with long nails on the word, and
Yeah. Yeah.
it's not really a matter of not wanting you guys to slay, but it's also a way of, infection control, number one. Two, for hygiene purposes.
Mm.
Because imagine you're
Yeah.
touching the patient with your long nails. Of course, you might say, I might wear gloves, but that might not be enough. You still need
Mm.
to practice hygiene
Yeah.
like
Yeah.
properly,
Okay.
because you're also at risk of transmitting some of the infections on the ward. And unfortunately, no, at least for the doctors who are working, in as much as they are not getting paid much. At least they're getting paid. For you as a
Yeah.
medical student, if you are to get sick, it will be a whole different story altogether. So you
Mm-hmm.
really need to take care of yourselves,
Yeah.
and take that opportunity to learn, especially like when you are still like when it's your first rotation, clinical rotation.
Mm-hmm.
It's fine to make mistakes. People
Okay.
are going to laugh at you, obviously,
Okay.
because there
Yeah.
are certain things you're going to be saying that doesn't make sense, but it's part
Yeah.
of the learning process. Just because someone has laughed at you, it shouldn't discourage you, really. Because
Yeah.
at some point, someone laughed at me for,
Mm-hmm.
saying certain things that did not make
Yeah.
sense. Just take
Yeah.
part in the whole process, clinical process. If you're asked to clerk patients, just clerk patients. Just
Mm.
have the confidence to even present, in as much as it's not making sense. That's how
Mm-hmm.
you learn. You only learn by doing certain things, and you only learn by also making those mistakes. Because you don't
Yeah.
want a situation whereby you're just hiding behind others. You're not learning, right?
Yeah.
Then when
Yeah.
you get to final year, unfortunately, you can't be hiding behind others, because like it puts you on the spotlight, and you're
Mm-hmm.
still on the same level with someone who's third year who just started clinical rotations. So
Wow.
I feel like you rather make mistakes whilst you're just starting, rather than when you're in final year.
Mm.
Because final year, it has got a lot of pressure. It puts a lot of pressure on you. Like, you need to be doing what rounds, you need to be studying, you need to be revising for your exams. So it
Yeah.
might be so difficult to have time to even like learn other things that
Okay.
you would have missed in third year. So take as
Okay.
much time to learn from the words, because
Okay.
those are very, I think it's the most important part of medical school, really, because
Okay.
patients are your best teachers. You learn from patients. Don't be afraid to touch patients, examine patients,
Yeah. Yeah.
examine as many patients as you can, clerk as many patients as you can. That's how you just learn. If you do not do it on a
Yeah.
patient, it will be so hard to just learn from the textbook. And unfortunately, the examiners will know that you've been not been attending ward rounds. Even like the way you present,
Yeah.
it
Yeah.
show that you haven't been attending ward rounds. So it's really
Mm,
worth it to go for ward rounds. I know sometimes it can be it can be so boring, and sometimes can be so discouraging. You get there, you're trying to present, someone laughs at you, or someone can actually scold at you that like your presentation is not even making sense, you're not reading. It can be so
yeah.
discouraging, but I mean it's part of the learning process. At the end of the day,
True.
all you want is your degree.
True. Thank you, sis. Thank you.
Yeah.
All right. We are in the last segment now of our interview, which
Oh.
is relationships and dating.
Oh,
Because you're a wife and you've been a wife for now, what, 2 years? Almost 2 years?
yes, I've been a wife for 2 years. Anyway.
Exactly, exactly. So, I mean, we have a lot to learn from you. So, my first question is, no, I'll start with the hard question. Not the hard that hard question, but I think a very important question to me and my friends. I know this will mean something to them. Um, what would you tell the girls who are in med school who think that when they finish, they may be too old to get married, or maybe it might be too late for them when they finish school?
Oh, okay. The thing is, guys, it's actually funny that you think like being 25 is being old. To be honest, 25, honestly, you're still very young. Because like most of the
Yeah.
people, they finish medical school around 25, 26, thereabout.
Mm-hmm.
Of which, according to me, it's not old.
Yep.
So the thing
It's
is,
not.
uh, when it comes to certain things like marriage, having babies, the timelines are really different. I
Yeah.
think you just need to come to an understanding that this part of life is now different from the previous years, because like I think like we're just accustomed to the fact that like you guys you go to the same school together. Like when you're in grade one, you
Mm-hmm.
go to the second grade with the same people,
Yeah.
then you go up to grade seven, then like your stages in life, they tend to be the same. But like
Mm-hmm.
once you get to college, really, once you get to your 20s, the stages are going to be different. You'll find
Yeah.
that someone
Yeah.
is still in school, they're already married, someone is pregnant, and they're still in school. So there's
Yeah.
really no time frame for marriage, for even dating. You can still find love
Mm-hmm.
in your 30s. You can still find love in your
Yeah.
late 20s. You can still find love even in your 40s, really. There isn't an age limit to finding love. And when it
Yeah.
comes to marriage, I've seen people who actually like got married early, 22, 21, even 23,
Mm-hmm.
even,
Mm-hmm.
and who are actually happy. And
Mm-hmm.
I've seen people who got married in their late 20s, they're happy. I've seen people who got married in their late 30s, they're also happy. So it's
Yeah.
not really a competition. You just need to like sort of have an understanding of the stage you are in life, because
Yeah.
things are going to be happening at different times. Unfortunately, unlike
True.
what you were used to, this time around is going to be different. Even like the in terms
Yeah.
of the finances, the financial levels are going to be they're going to be different. So if
Okay.
you just come to terms with that, you be at peace, really, and you just be waiting for
Okay.
your own time for you to get
Yeah.
the
Yeah.
love of your life, be it
Yeah.
even like something not even related to love. Even like when it comes to kids,
Yeah.
your time will come. So I would
Yeah.
say you don't have to be miserable just because you're single. Right now,
Mm-hmm.
you guys, if you're dating, I mean, you can still date with intention. Those who are actually
Yeah.
like in relationships whereby the guys are proposing, you can still get married. You can still get married and still be in school. It's still okay, really,
Okay.
because opportunities are going, like they're going to present differently. It's not going to be the same.
Mm-hmm.
So you just need to
Yeah.
have an understanding of yourself, really, not to look
Okay.
at the other person. Because if you are to say, this guy's proposing me, I might just need to wait till I graduate. Maybe the opportunity might not be there when you graduate.
Okay. Okay.
Yes.
Yeah.
And
Yeah.
I also feel like if you're not in a relationship whereby you see marriage, this is the
Mm-hmm.
time for you to develop yourself, to become a better person so that you're also
Mm-hmm.
bearable as a partner,
Yeah.
because looks alone, they are not good enough. You also, like, character wise, you need to be a good person. You also need to be
Mm-hmm.
someone who's bearable to hang out with, someone
Mm-hmm.
who's habitable in a way. Like, you don't want to be married to someone who doesn't even care, or who doesn't communicate, or who's moody all the time. This is the time to work on
Yeah.
yourself to become a better person,
True.
because your character goes a long way than just looks. Because sometimes looks might fade. When you get pregnant, you might not be as good looking as you were. So those,
Yeah.
like,
Yeah.
your character then comes into play.
Mm-hmm. Mm-hmm.
And another thing is be visible.
Okay.
uh you don't need to be, staying indoors. If you really want to meet the love of your life, you need to be outside, guys, because most of the
Yeah.
people are outside. How do you expect to meet your partner when you are just always in your room, when you're just always in your house? So you
Yeah.
need to be very visible, be it church, be it going out for lunch, going out for breakfast, be
Mm-hmm.
it even like joining a running club. You just need to
Yeah.
be able to be interacting with other people so that you meet new people. Even on social
Mm-hmm.
media, there's nothing wrong with posting a picture here and there, so that people actually know you are there,
Yeah.
because those
You're
might be
right.
your prospects. You never know. Like, you never know.
Yeah. True.
So
True.
you really need to be visible so that because the moment when you leave school, it's gonna be different. At least, like, when you're in school, it's so much easier to meet someone, because, like, you be on the same campus with other people. But, like, when you
Mm-hmm.
get to fourth year, you then realize that most of the people will be younger than you. So the chance of
Yeah.
meeting people, they'll be
Hello.
low, except your
Yeah.
classmates. There'll come a time whereby you're only exposed to your classmates. So you need to be
Mm-hmm.
doing something so that you are seen, you
Yeah.
know.
Okay.
Yeah.
Okay. So.
That's what I would advise. And for me, really, when I was your age, I wasn't in a relationship that I was really looking forward to getting into that person. No, I wasn't even in a
Yeah.
serious relationship.
Yeah.
Uh,
Yeah.
I met my now husband at 26 when I was about to turn
Yeah.
27, and
Yeah.
things actually worked out. I met my husband, like, when I was almost 27. So you saying you're old for being a 25-year-old or 26-year-old, I mean, that's ridiculous. I mean, you're still
Yeah.
young. And right
Yeah.
now,
True.
things are really changing, honestly. Even
Yeah.
like the WHO definition of youth is actually changing. The age group is changing, really. So things are now different. The
Yeah.
25-year-old mark is no longer the the mark for you to be married by then. Like, things are different.
Mm-hmm.
So
Yeah.
you just
True.
to be able to live in the moment, not just live miserably just because you're single or you haven't met the one, really.
Yeah. Thank you, sis. Do you think we
Yeah.
should only get married to doctors? Or no? What do you think?
Maybe only to
I
talk like what?
don't,
No.
I
I mean, who
don't
says
know.
that? Who says
I don't
that?
know. Maybe shouldn't doctors marry doctors?
Oh, no, 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 no. When it comes to a
Yeah.
life partner, really, the profession, the profession really, it doesn't matter. Because, like, what defines a person is not their profession, it's their character
True.
and who they are as a person. I mean, because you
Yeah.
can't, I can't say I'm Dr. Clara and I identify as a doctor, that's it. uh
Yeah. Yeah.
Behind that title there is more to that. This
Yeah.
is why you then
True.
find people getting married to even doctors, and you find out someone is actually cheating on you, you
Yeah.
know,
Yeah.
and
Yeah.
or they start to abuse you. So I feel like when it comes to choosing a partner, the title is really not as important, but you would obviously want to get married to someone whom you're like equally yoked, like in a
Yeah.
way. Like let's say in
True.
terms of qualifications, you would want someone with a degree. Of course, like it
Yeah.
does happen that sometimes you fall in love with someone without a degree, but it then becomes difficult for you guys to have a mutual understanding because of
Mm-hmm.
that lack of a degree. You know, someone may not really understand what university life was like. They might actually judge you
Yeah.
for your lifestyle in uni because of
Yeah.
the information they'll be getting from other people about university girls. You know, like the misperception people have about uni
Yeah.
girls.
True. Mm-hmm.
And you need to get married to someone who understands you. You can be married to
Yeah.
a doctor who doesn't understand you. You can be married to a
Yeah.
lawyer who doesn't even understand you. You can be married, So it's really not
Mm-hmm.
about the profession. It's about someone whom you can connect with.
Okay. Okay.
Yes.
Okay.
Yes.
Someone who
And
can be a
also
safe
someone
space.
whom your goals are in alignment.
Okay.
Let's say
Okay.
you all get, like, let's say maybe you all want to leave the country, or
Yeah.
you all
Yeah.
want to become millionaires at some point. Like, you need to
Mm-hmm.
be married to someone who's got the same goal, so that like when you start now preparing to get there, like it won't be much of a hassle because like you are in alignment in a way.
Yeah.
But
Yeah.
the profession, like it doesn't have to be the same profession. You can choose to get married
Mm-hmm.
to a doctor. I mean, if you happen to get a doctor whom you have an understanding with, whom you love, I mean, there's nothing wrong with that. If you happen to
Yeah.
meet someone who's not a doctor, who's also
Yeah.
of a different profession, it's still okay. At the end of the
Okay.
day, you just want to get married to someone who has a better understanding of your profession, not necessarily
Yeah.
doing the same profession as you.
Yeah. Yeah. Thank you, sis. That is
Mm.
wow. My friends are going to love this one. Thank you so much. Ah, this was so good. And thank you just for saying yes to the podcast and doing this with me, for spending 42 minutes on a call with me.
Well, it hasn't been easy with the network situation, but I'm actually happy
Yeah.
I took part. I took part in it. It's
Yeah.
actually, like there's certain things I might take for granted now, just be like, it's something small. But like when I'm having a
Yeah.
conversation with you, I tend to realize at some point I was at your stage, and those are the things that
Yeah.
used to bother me or worry me. And now I now have some of the things, it's actually
Yeah.
very
Yeah.
important to engage with other people at different stages. You tend to appreciate how far you have come, really. So it
Yeah.
was really
Yeah.
also helpful to me. I really enjoyed every bit of it. And
Oh,
this is really amazing that you're doing your own podcast.
thank you.
I
Thank
am
you. It's
so
so
proud of
exciting. I love
you.
it.
I am so proud of you, and I wish you all the
Thank
best.
you.
I hope your
Thank
friends are
you
going to
so much, sis.
stay.
Yeah, yeah, I think they are. You are still my role model. I still look at your pictures here and there. I'm not a stalker, but just saying.
No, but
Yeah,
it's
I'm
okay.
just feel
I
so
mean,
inspired by you.
oh, thank you. I'm so flattered. I mean, no, I also do the same. I always look, at other people's pictures. Like it's good to have
Right?
people who inspire you, just to keep you in.
Exactly.
Yeah, yeah. It's a good thing. There's nothing
Exactly.
wrong with that. Yeah.
True. Thank you for being that person for me. And thank you for saying yes to the podcast again.
No, no, welcome. The pleasure was all mine. Thank you so much.
All right, sis. Bye.